right now to the New Jersey Republican congressman who warned that there would be cost. Leonard Lance is looking very prescient right now, said that there would be unimaginable fees and penalties, irreversible add-ons that would drag this whole health care thing down. But even these drag downs, Congressman, are bigger than a lot of folks thought. What do you think?
It's clear that we should have had this report before we voted. We suggested that we have it for 72 hours before we voted. The Democrats rushed the bill through, and as a result, we're reading this report after the fact.
But does it really change the equation, though, Congressman? As much as people can whine and complain about it, you know, pick out 10-year, 20-year projections, it's just another estimate, another crunching. And it is law, so get over it.
I think that when we take the majority come January, that we will repeal.
Do you think this helps you to do that?
Absolutely, because this is a report from a well-respected governmental agency, the actuary at CMS, and we should have had this information before we voted on the bill.
All right, but, you know, I raised this with Governor Pataki, and going to the courts to knock something out is at best a Herculean leap. So let's leave the impossibility of that aside, in my opinion. And then, let's say you do get a majority in the House and the Senate. Itself a bit of a leap. Possible in the House, tough in the Senate. You've still got Barack Obama in there. And this train has left the station. You know what I'm saying? That to tell it to come back, to derail it, it's a leap.
We think that we have the facts on our side, and we hope.
I'm not saying you don't.
The president will.
You might or might not. But is the president going to have a come to Jesus moment and say, "Oh, let me start from scratch"?
I hope he reads the entire report, and it points out, for example, of the 34 million Americans that will be covered, 18 million of them will be in the Medicaid program, and this is disastrous for the states because the states pay for.
Do you honestly think that, Congressman, he's going to come back and redo anything?
I certainly hope so. And
I know you hope so.
When we get the majority, he will have to work with us in a way he has not worked with us.
But he's not going to rework stuff he already did. Going forward, what presidents do who lose a majority in Congress, like Bill Clinton, is they change their strategy on stuff going forward.
I think that this is so disastrous for the American people. People will not be able to continue to have their health care coverage as he promised. 14 million Americans will not be able to continue
but this
with that.
November, you won't know if that's the case, right?
I think that the American people are smarter than that, and I hope that the president changes course.
Okay. Congressman, very good seeing you.
Thank you.
All right, now, do you think Democrats are unhappy now? Can you